And hello everyone, and welcome to 30 Minutes Thursday Tea Time at 3:30. Today you'll hear how the National Institute of Health Research is coping with the pandemic and embracing digital, along with two new additions to our portfolio, Rotageek, who help businesses perfectly predict and meet demand by effectively and fairly scheduling staff, and Vicodo on how to better engage with your remote audience. A quick shout out to our sponsors Investec, Lewis Silkin and Hayes McIntyre, who are standing by to give you free advice on wealth management, legal and financial. But first, in a week when the strong-arm tactics of one of the major digital powers backfired in Australia, and major employers like HSBC are making fundamental changes to their property portfolios by cutting 40% of their office space in the UK, there is a need to recognise that the new ways of working are here to stay. But who to turn to? Well, how about us? We focus on finding the right solutions partners in our ecosystem to help you deliver on your challenges. Solutions partners who are big enough to bend over backwards to help you resolve your challenges without being too big, with the risk of holding you to ransom, or too small to be able to cope with the needs of the larger corporate. All the solutions we have handpicked for our portfolio already work with household names and have got past the nappy wearing and potty training phases as well. And in the best cheesy traditions of retail, that's not all, folks. You need help implementing solutions or sharing the load? We've got a team of 75 handpicked C-level associates who'd love to help you as well. Some of our younger members are actually pictured here. One person who is no stranger to the need to embrace digital is John Nother, who knows a thing or two when it comes to business transformation. After 3 years as CIO at the card factory, he returned to Asda, where he was responsible for digital product technology underpinning Asda's online businesses, focusing on building seamless digital journeys for Asda customers. John then moved to a completely different world in March 2020, where he became Chief Digital Officer at the National Institute of Health Research. John, welcome. That sounds a bit like a baptism of fire joining the NIH as first lockdown started.
Yeah, hi Alex, and good afternoon everyone. Yeah, I mean, moving from sort of retail into the public sector, it's very different. I mean, Asda was a very established digital journey for its customers. You invested a lot over the years in developing that, and the NIH are a very sort of different type of organisation. A blank sheet of paper as a role, so a brand new role, an organization that's quite sort of decentralized in terms of its technology stack and really on its sort of digital journey very much at the start. So a real sort of blank sheet and a greenfield opportunity. But I think for me, joining during lockdown as well, which was also quite challenging, it still comes back to digital is about the customer. And no matter where you are, what you do, if you're engaged with people, then digital can really help you do that better. So for me, during lockdown, it was very much about understanding the business, trying to sort of set out my 90-day plan, really get my head around who's who, spend endless days on Google Hangout, but really get to a point where I've listened and then we can start to set out where we go next.
And I mean, obviously with COVID at that time and still around us, you must have hit the ground running. What are you most proud of in your initial sort of months after joining?
I think I got asked to lead a piece of work for the vaccine task force, which was to build a COVID vaccine registry. That allows the public to register their permission to be contacted to take part in vaccine trials. We were asked, could we get something ready in about 8 weeks' time? And that was from a standing start where we had to sort of form a partnership with NHS Digital and working with the Clinical Research Network team to really overnight figure out how do we do this. We've got a press and a marketing campaign that's, full steam ahead, so we have to be ready. And we managed to go live on the 20th of July. To date, we've signed up, I think yesterday it was 451,000 people, and we provided participants into the Oxford AstraZeneca Novavax trials. So I think for me, this was of a career really, one of the most proudest things I've ever been involved in. And I think the nugget that I'd sort of take away from this for people was, it was a bit uncomfortable because we were moving so fast, but I think as a leader, you just have to try and create the energy and excitement around this and why we're doing it, which was a really, proud thing for us to be part of as a team. I'm focused very much on MVP. So we delivered parts of the solution, really drip feeding it as fast as we could to sort of match the campaign. And it's been a great success for us.
Well, I almost want to go backwards for a moment. So where does the NIHR fit into the grand scheme of things?
So the NIHR is it's a government-funded organisation, and we basically underpin health and care research in the UK. So our sort of organisation has 6 different business units or coordinating centres that focus on different elements of that, which from my perspective is clearly quite challenging structurally, because coming in trying to look at an organisation that is stretched with the pandemic, is decentralized in terms of its organization, its exec boards, and its technology stacks. And so the big sort of challenge for me and for the organization is, how do we start this journey, and how do you sort of set out your ambition in a simple way that people can understand, and take them on the journey.
And I mean, has there been a precedence? Were you the first digital person or head of digital at NIHR? I'll get it right before the end of this.
NIHR. Yeah, so it was a new role. It was previously led by sort of one of the execs as an ambition to drive our sort of digital transformation. And I think as an organisation, they recognised the need to invest in people with that experience who can do it, as a full-time job. And really, I think what I brought into that and what they were looking for is someone from retail. Well, not someone from retail, someone with a real view around customer, which I bring from a retail perspective, because ultimately it's about building services that are very customer focused, be that as a researcher, as a participant, and really helping people engage into research and hopefully save more lives as fast as we can.
So obviously a new role. What sort of challenges have you faced then as a result, both sort of organisational and structural?
I think the biggest challenge, I touched on it a second ago, was really where to start, because as an organisation, you can imagine we're very data rich. We have lots of data. The amount of people that are involved in health research, health and care research, is vast. There's probably so many areas where you can add value. And yet, you need to start somewhere. So the challenge really was, how do you set out what this transformation is all about? And I focus very much on sort of, it's about engagement, that customer focused experiences, and it's about interoperability of data, integrating it and automating it. And it's about equipping our organization with tools and capabilities to drive that digital mindset. And so I think that in my 90-day plan, that was a key output, and that allowed me to really get people bought into where we're trying to get to. And I got support then to really get into a much more sort of deeper exercise to really lay out the pathway of how we're going to do this.
Got you. Okay. And this idea of sort of focusing on the customer more, how are you managing to get that viewpoint and that approach adopted more broadly within the NIHR?
So the way we approached post our 90-day phase, the way in which we've really shaped what it is we're going to do, I set out an approach where we broke down the research pathway into the different stages. So for example, the very first piece might be identifying the topic of research. The very end bit is disseminating the results. And we split the pathway down into 10 steps. And we brought together stakeholders from all over the UK, using Zoom and digital collaboration tools. And we really focused on what are the barriers that exist for different stakeholders at each stage. We didn't even talk about technology in the first workshop. And then once we really understood what wasn't working, we were able to follow up with a second workshop and really start to think about how can digital help really solve that problem? And so that really allowed us to come at this with a, what is it we're trying to deliver for the customer of the services at that part of the life cycle? And I think that has really helped get a very sort of supportive and inclusive approach to what we're doing, rather than trying to sell a piece of shiny technology that's looking for a problem.
So obviously, after your initial baptism of fire, you've now got your feet firmly under the table. What sort of objectives have you started to set moving forwards?
So we've set out 6 objectives that under which we'll deliver initiatives over the next number of years, and we're funded by the comprehensive spending reviews by the Chancellor. So we've been successful in securing funding for the year ahead, which is fantastic. And so our objectives, there's 6. So how do we accelerate end-to-end research? A real sort of focus on the integration and interoperability of data and adopting data standards, because if we can accelerate the steps of that pathway and how data moves through it, we can help researchers to really drive that forward faster. The second one then is very much about increasing awareness, recruitment and diversity in research. We know we want to demystify even more what research is, build out our sort of strengths and partnerships into the communities and into charities, and really get content about what we do much more broadly seen, and also hopefully then attract a more diverse participant set into the research. So what tools we can build to help us do that. The third one then is very much about when you're on a trial, how can we really make that engagement experience for participants really personable and relevant, and ultimately build a relationship there long withstanding is the goal. So digital tools to help communicate with your researcher, saying thank you for participating, and signposting where the results are will be the focus. The fourth objective is really about making it easy to track and value the impact of research. A piece of research can go on for many years, so how do we really demonstrate at pace where the impact is being seen? And so looking at various identifiers that we can build into research to see that. The fifth one then is very sort of data focused around greater sharing of data, value and insight. What cloud tools can we put in place, data lakes to take in structured and unstructured data and really develop more insight out of the data that we have, and equally tools to help our researchers deliver research with predefined data standards and tools to help them host the data and analyze it. And then the sixth one's very much about the organization really investing in a very sort of forward-looking view about digital data and technology, the tools for our colleagues to really help them in the role, and the sort of like the thirst to think digital, as a mindset and go through that cultural change as an organization. So a busy few years ahead. And I'd say that, the real nugget I take away from this is you have to start somewhere. There's so many things we can add value to, but we've done the listening. It's focus now is about putting rubber on the road and setting out our plan and starting to make a difference.
Listen, Chris, that's absolutely John, that's absolutely brilliant. I really appreciate those inputs. And to continue the theme along these lines, I'd actually like to bring in our next speaker now, who's Dr. Chris McCulloch. Chris, do you want to explain how Rotageek can actually help people in business as well?
Hi, my name is Chris McCulloch, the CEO and co-founder at Rotageek. So Rotageek allows organisations to create better work schedules with the aim of being operationally more efficient, having happier customers and happier staff. And we solve that problem in 2 ways. We allow organisations to move away from paper spreadsheets, legacy on-premise solutions, onto a modern cloud-based platform where managers can log in on a simple user interface, create schedules, and when they're content, approve those and send those out. Staff receive their shifts on their mobile device. The thing that makes us different is that we can create data optimized staff schedules with the aim of better matching your staffing to your customer demand. And there's 3 elements to this. First of all, forecasting. We take historic business data and we forecast out future demand. We then create a labour model. So given that forecast demand, how many people do I need? How many staff do I need to service that? And then we use that as an input to schedule optimization alongside the number of staff you have, their contract requirements, but also their work preference, so you empower staff to have a better work-life balance. And the problem that we solve is that these inputs change, and COVID has shifted those significantly. So we see businesses where their client behavior has shifted, therefore the staff that you need to meet that client demand has changed, and often the business strategy and the delivery has changed across industries. Yet 50% of our target clients use spreadsheets to schedule their staff, and therefore they don't have the tools to react. And the problem that we solve is shown graphically here. So bottom left hand graph, what we often find is in organizations when we go in, the staff that are scheduled on that yellow line is mismatched from the staff that you need on the green line. So we see overstaffing at quiet times, understaffing at peak times, and the aim of Rotageek is to minimize those deltas. And we're able to show real business benefits. So as you would expect, we reduce admin, but we also drive efficiency. So we more effectively distribute the payroll for organizations, and therefore there are less gaps and therefore less need for agency spend. But we're also able to show an increase in operational efficiency. So in retail, we drive revenue. But on top of that, because we empower staff to have a better work-life balance, you see lower staff turnover, and customers are happier because they're served by the right people in the right place. And this is a retail case study of a UK and European retailer with whom we work, and what we're able to show is that before we even went into stores, we're able to demonstrate that we're 14 percentage points better at matching their staff to demand than their current solution. But in the intervention stores with Rotageek compared to control stores, we saw an increase in footfall conversion. So of those people that walked in, they were more likely to buy. When they did buy, they bought more, so basket size went up, and they left happier. So that's just one example of how we can use data optimized staff scheduling to be a better employer in the post-COVID period.
I mean, COVID, Chris, has caused a huge changes in the two verticals you mentioned, the retail and health. So I guess how does this affect your hypothesis and business case for clients?
Yeah, so the fundamental business case around sort of optimizing staff to demand is still there, but the challenge we have is that demand has massively shifted. So clients that are really, their operational efficiency requires them to accurately forecast their demand. It's a huge challenge, but I think what we're also seeing is a shift from operational efficiency, particularly in supermarkets and sort of parallels in supply chains, operational efficiency pre-pandemic, but now a bit more operational resilience. And you see that in supply chains, but also in scheduling. How do you create schedules that are much more resilient and much more able to cope with people who need to self-isolate or don't turn up?
Okay. And you mentioned empowering staff as a component of your value proposition. Can you sort of elaborate on how you deliver this?
Yeah, so I guess one of the sort of key data science areas is we allow staff to express a preference about when they work, and that allows employers to be much more flexible and manage work-life balance, really with minimal overhead for the business. But there's some really clever but not very technically advanced ways of doing this. So things like having linked leave. So, certainly in the big employers, supermarkets, for example, might have married couples and or partners in an organization, and the ability to link schedules so that you can offset them and manage childcare, or link leave so that you can request leave as a pair. And I want my leave either approved as a pair or rejected as a pair. Don't approve one of us or the other. And so these are the things that I find fascinating, where we can really use technology to make the working lives of our clients' teams much better.
So if that's out there, and that clearly makes things a lot easier, why do you think organizations have been slow to move away from spreadsheets or paper in an area it seems so obvious that automation, or at the very least digitization, can help?
Yeah, it's a really good question. I think some of it is Excel's our biggest competitor. So Excel's good, and you can cope to a certain level, and that level is quite large. We have big organizations scheduling their staff on paper and Excel, and I think until recently the business case for scheduling was much more around admin saving, and therefore there's not a huge drive to move away from something that works. But actually what we're now able to show is that there is upside. We can drive revenue, and we can minimize staff turnover, increase customer NPS. Excel can't do that. So I think that's what we've seen over the last year or two is, we've got that referenceability now, but also clients are much more aware of the ability of data science to drive really fundamental change.
That's great. Thanks, Chris.
Thank you.
Perfect. At this stage, I'm very keen to bring in a very different presentation from our friend Uh, so sorry, I've got huge problems with PowerPoint today. From Marcus from Vicodo. Marcus, do you want to explain how video is part of the solution to future-proofing businesses and personalization?
Yes, thank you very much, Alex. It's a pleasure speaking here today. Vicodo is a customizable live video and chat communications platform with CRM elements. It is simple enough for one person and powerful enough for big enterprises. Vicodo allows businesses to connect in an easy and effortless way with their customers. Our software as a service solution works on every web browser, on the desktop and on mobile devices. No additional software or app installation necessary. Our branding capability is one of our most beloved features. For companies, it looks like they are using their own and tailor-made video solution. We are working with many different industries, from banking and finance to field service to telemedicine to sales and to insurance, just to name a few of them. They want to be more efficient and they want to communicate with their customers in a personal way. Face-to-face video calls are the perfect solution for that. Our customers realized that the future of their customer support is personal. More than 89% said that video support is the fastest and most efficient way to resolve issues. Today, I'd like to show you just one of countless examples how dramatically we increase the efficiency of our customers with Vicodo. Let's imagine a customer has a flooding at his home. Now he wants to inform his insurance about the claim. As you can see here, in the traditional process, it takes quite some time, sometimes weeks. Many people are involved, data is not structured, and it costs a couple of €100 for letting an adjuster drive to the customer and review the claim. But since the beginning of COVID-19 and its various restrictions, this process is no longer working. The safety of customers and employees has become a major concern. We have the perfect solution for that. With Vicodo's smart and intuitive dashboard, you can speed up the entire process. The agent has everything that he needs without leaving the office or his home. Let's take a look at the streamlined process with Vicodo. When a customer reports a claim, the adjuster can invite him right away via email or SMS. They can start a video call instantly. During the video diagnostics, the adjuster can take pictures and take notes. After about 15 to 20 minutes, the fully GDPR-compliant face-to-face review is done. The customer is very happy. Vicodo is, of course, not only usable for flooded houses and broken starships, we are also working with companies who are using Vicodo for sales and customer support. For them, it was not easy to find the right video communications tool, impressive white label capability, and the option to connect via API with existing systems and workflows are usually not easy to find. Thank you very much, guys.
That's great. Thanks, Marcus. I have a couple of questions, if that's okay. How is Vicodo different from Zoom or Google Meet?
Oh, it's extremely different. Our system is tailor-made for direct end-to-end communication, so with your customers. Because when you're using Meet or Teams, you're doing kind of advertisement for these companies. With our solution, everything is fully branded, so it looks like it is your tool. And it is not only for a one-time conversation. You have every data structured for one customer or one case, and you can work in a team and you can integrate this entire system into your existing workflows.
Okay. And how much time does it take to start with Vicodo?
If you are slow, 2 minutes.
Okay.
It's really super fast. You just have to sign up. Our team will support you and you can do everything on your own, because usually with other tools, they say, yeah, okay, maybe in 8 weeks, you're ready to go. No, these days you have to be quick.
Yeah. And how exactly does branded software benefit companies?
Oh, in big wise. So I think, or our customers say that after they introduced our technology and everything looks like they've tailor-made it for their customers, it's a better appreciation for their business relationship, and customers realize, oh, okay, that's cool. It's something serious. and that's definitely a huge difference.
Okay, so I guess the killer question: if I want a custom application, why should I choose Vicodo instead of hiring a software house on developing my own?
First of all, I wish you a best of luck doing this on your own and a couple of years time. So you know what, everything is ready. We have not only one customer, there are quite a lot, and we have a big team testers who are working on the system every day to improve it. And when we have some interesting feature requests from one customer, because we are software as a service, it's for all our customers. So I think that's a big benefit. And you, of course, if you are able, you can do this, but it takes, again, time and quite some money.
Perfect. Thank you, Marcus.
Thank you.
Marcus, thanks very much indeed. First of all, I'd love to thank all our speakers today. John's told us about how he had to hit the ground running with the vaccination register, the differences between working in a corporate environment like ASDA and the challenges of encouraging the NIHR to embrace digital more. We then heard from Rotageek about how smart staff scheduling can deliver increased profitability, productivity and well-being. And then Marcus from Vicodo about how video can bring customer engagement to life and how they can save a whole variety of industries significant sums of money. If you've missed one of our previous sessions and would like to access a recording, please just let us know. Otherwise, please make a note in your diaries for 4 weeks' time on Thursday, the 25th of March, when we'll be joined by the Chief Marketing Officer at Investec. Thanks as ever to our sponsors, Investec, Lewis Silkin and Hayes McIntyre. Thank you for joining and look forward to catching up with you next time. All the best.